have definitely been useful, particularly because the whole world has focused on healthcare. Yeah. Everyone has been talking about healthcare for the past 2 years. I think more than ever, people appreciate the role that health plays in their lives. I think more than ever, governments now appreciate investments towards the health sector. And Kenya has not been left behind. The COVID-19 pandemic has seen more allocation of resources internally, at least within the Ministry of Health, within the health sector. However, of course, these resources have been primarily towards putting in place infrastructure to deal with the pandemic. And one of the gains that we've seen, and I'll start with the positive side as I try to highlight where we have challenges. On the positive end, we've seen a lot of infrastructural developments when it comes to the capacities of our health facilities to deliver services. I think one key element is that we have more healthcare workers working in the health space. Many may not know, but through this government's term, we've actually employed almost over 10,000 personnel. And these personnel were actually being onboarded as part of the UHC program to ensure we have more nurses, more doctors. And so what we did is we quickly were able to utilize this same staff for COVID-19 pandemic. And so that's a silver, that's a good thing. Yeah. More grounds, more boots on the ground, more people working, more people offering services, even obviously also, ensuring that there's some form of economic stimulus by employing more young people. Right. So that was the positive side of things. Of course, if we look at hard infrastructure, we've invested and we continue to invest in oxygen infrastructure across counties. There's been perhaps, let me say, a relooking at, do we have enough needs of oxygen in the countries? If we look at basic things like isolation centers, Kenya had been lucky for the longest time to never deal with a pandemic. Ebola, we had threats of Ebola, but it never got here because we were ready and we were safeguarding the